morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going.
Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophill Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophill Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophillhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophillhospital.com.
Okay, the 26th day of April 2023. My name is MC Kalia, and this is the Morning Glory Show coming live from Dawi Afrique Photography. Dawi Afrique Photography is a production house based in Eldoret Zion Mall. Anytime you have anything that you needed to be documented, be it video content or photo content, then make sure that you consider working with Dawi Afrique Photography. My assurance is that you will get a good experience in front of the camera, and also well documented work at the end of the job. So if you are planning an event, if you're planning a wedding, if you have a conference, any kind of event that you want it well documented, consider working with the Dawi Afrique Photography. Now, also in addition to that, if you'd want to be addressed, walk into D-Square Fashion House. D-Square Fashion House is situated at the 4th floor of Ketia's building in Eldoret town. That is actually the CBD in Eldoret. So make sure that you walk into Ketia's building. If you need a nice suit, if you need to dress to suit that particular occasion that you are attending, then consider also being dressed by D-Square Fashion House. And now they have a school. So that means that if you want to take up fashion as a career, then you can also walk into D-Square School of Fashion Design and Tailoring. Now, the advantage of studying from D-Square School of Fashion Design and Tailoring is that you get an opportunity to learn from the best. Immediately you exit the school, then you have an opportunity of walking into the fashion house and getting a chance to actually do these things practically. Back to the topic of the day. Today is a Wednesday. It is a healthy, wealthy, wise Wednesday. With us is Dr. Mwadime from Tophill Hospital. He is a resident MO at Tophill Hospital. Of course, he's been here before, but then as I told you, Daktari, we always have new people watching. We've been growing over time. I think the first time you came here, we were at around 4,000. Right now, we are at 6,000 on one of our pages. At that time you came, we were at around 9,000 in one of the pages. We're now doing 11,000. So there are people who don't know you. So once again, I'll give you a chance to introduce yourself. Karibu.
Oh, thank you. Thank you, Kalia. As my host has told you, I'm Dr. Nathaniel Mwadime, medical officer at Tophill Hospital, and I'm glad to be here again.
Okay, thank you so much for that. And of course, if you already tuned in, let me know where you're tuned in from. Dr. Mwadime this morning is going to teach us about common abdominal conditions. Of course, some very complicated terms for me there. Hope I won't be biting my tongue while I try to talk about some of these conditions. But then this morning we'll start with a gastritis. Hope I'm saying it right. So, Daktari, can you tell us what causes gastritis? Okay, now gastroenteritis. Okay, Daktari, take over.
Yes, Kalia.
I think I rehearsed too much reading the names that I already have the fear to mention them.
Gastroenteritis, basically, is a common term we use for an abdominal condition that mainly presents as a watery diarrhea, loose stool. That's diarrhea, consists of diarrhea, vomiting, nausea, sometimes fevers. Fever just means hotness of body that presents in such patients. It's a very common condition, more so for children under 5 years of age. And its major symptom is diarrhea. Diarrhea, loose stool. That can also be accompanied by vomiting. The reason why it's usually very, how can I say? The reason why it's an emergent condition, emergency condition, is because of the after effects of diarrhea and vomiting, or gastroenteritis. So ideally, most of these conditions are self-limiting. Self-limiting means that there are conditions that it's a condition whereby it might not require medication for it to resolve. It just requires supportive care for it to resolve. So most individuals that get gastroenteritis, or let me use diarrhea, most patients that get diarrhea, the disease is self-limiting. You'll find there are two major causes of diarrhea. You can have bacterial diarrhea or viral diarrhea. And most of the time it's due to food poisoning for adults. You've gone into a joint, a place, you've taken food, all of a sudden you have a stomach upset, you start having severe diarrhea. The reason why I'm saying it's self-limiting because most individuals don't even present to hospital. They find out that they have diarrhea probably 1, 2, 3, 4 episodes. It resolves overnight, or within 12 hours it has resolved, and they go back to their life. Now, the reason why we are creating awareness for such a condition is because of the many causes of diarrhea that are out there. As I said earlier, there's viral diarrhea and there's bacterial diarrhea. Now, some of the common causes of diarrhea, which is life-threatening, can be things like cholera, things like typhoid, things like amoeba, which causes amoebiasis. Now, when you do have these symptoms, and apart from having diarrhea, multiple episodes, and having vomiting, when you do notice that you're having generalized body weakness, you're having fevers, you cannot feed, the risk of developing complications of diarrhea are usually very high, more so for children under 5 years of age. That's why when you have diarrhea, when your child has diarrhea under the age of 5 years, it's very important to present to a hospital center. Because one, we do tests to find out what's the cause of this diarrhea. If it's a bacterial diarrhea caused by one of these common conditions like amoeba that we see, or common worms that are found in the intestines, we can give medication to treat the cause and also supportive care. The most important care for patients with gastroenteritis or diarrhea is supportive care. By supportive care, I mean rehydration therapy. Be it oral rehydration, drinking water and fluids that contain electrolytes, and or intravenous rehydration, meaning rehydration via the IV line. The reason being, when you're diarrheaing and vomiting, you're losing important fluids and electrolytes. And take, for example, the outbreak that happened in Mukumu and the other school that led to its closure because of multiple patients getting diarrhea secondary to cholera. The condition becomes very deadly. When you diarrhea so much, you lose a lot of fluids and you're not replacing these fluids, and it leads to conditions like acute kidney injury, whereby your kidney fails. So this can be life-threatening in itself. So rehydration therapy is very important. We replace the fluid you're losing. That's the main point. We replace the fluid you're losing. Apart from us using antibiotics to treat this, the root cause or the bacterial infection that is causing it, we need to replace whatever you're losing. And the rate of replacement needs to be very high. And that is why we say seek medical attention as early as possible. Because it is at this point that you're going to find out, is it bacterial or viral? Is it self-limiting, meaning can it be resolved on its own when we just give you conservative management? How do we need to hospitalize you and monitor you closely? So instead of ignoring most of these diarrheal conditions, if you find yourself that you have more than 3, 4, 5 episodes of diarrhea within a span of less than 12 hours, you're really, you're weak, your body is very weak, you're having fevers, you're vomiting, you cannot feed, you cannot take water, that's the point you need to rush to a healthcare facility. Because the moment you cannot take anything via your mouth, orally, we cannot replace whatever you're losing. And the more you're losing, the more it causes major complications to organs like the kidneys, organs like the liver, because you're losing too much of fluids in your body. So gastroenteritis is a very important condition, not just for adults, but for more so for children under the age of 5. Yes.
Okay, and let's talk about typically how long it takes before you categorize diarrhea as severe, and of course after how long should I now be like, okay, I now need to rush to the hospital? Because most of the people, maybe me included, when you start diarrheaing, shut after and you're done with that. So when do you categorize diarrhea as now severe?
So I will answer it in two points. One, I will want to tackle the children under 5. So if you have a child under the age of 5 years and they are diarrheaing, first episode, second episode of watery stool, rush them to hospital. Because the compensation for children is lower than compared to adults. They will lose more fluids and they will not be able to compensate on their own. And most children that actually diarrhea don't take anything, because they have nausea, so they don't drink any fluids. So they'll diarrhea, but they don't take any food inside. And that's why they're at a higher risk, because they're not replacing whatever they're losing. So for children under 5, do not wait. For young children, just don't wait. When you're seeing them having 2 episodes a day, just rush them to a nearby health facility. Let's do the test, find out, is it viral, bacterial, do we need to give antibiotics or not, and which kind of supportive care can we give. Let the healthcare provider make the decision for you. Can this child be able to feed or not? that's the point we want to look into, because fluid rehydration is very important. Now, the second bit now for adults is there's this misnomer that usually happens whereby people, when they start diarrheaing, they rush to antibiotics. I start by saying that most diarrheas are self-limiting. Most people adults that get diarrhea, it resolves on its own. You just need to rehydrate. Now, at what point as an adult do you see that this is now an emergency for me? Usually, most of the time, the how can I put it? The feeling that you get can actually signal you. You've had one episode of diarrhea. You've taken maybe you've taken food in a place, or you've drank water in a place that you're not used to. Then you have one episode of diarrhea, and then after that it stops and the abdominal pains stop. You don't need to come to hospital. Just rehydrate. Or you find yourself that you've started diarrheaing, you're having multiple episodes, you've gone like 3 to 4 times to the toilet to diarrhea in a span of 3 or 4 hours. Your body suddenly becomes very weak. You cannot even take fluids. You're so weak, you can't even drink water. So what do? Rush to hospital. Because at that point, unasema aje imekulemea. At that point, imekulemea already. So it's not like I will tell you have 4 episodes of diarrhea before you come to hospital, or 5. No. The body will tell you, because ideally when you diarrhea, some people you can take 2 minutes in the toilet, a little bit, another one take longer. So the body will actually tell you that at this point, no, I need to go and seek medical help. How weak are you? Because someone might have just 2 episodes of diarrhea, but they are very weak to the point that they cannot even take fluids. Rush to hospital. Someone else will have 1 episode. Someone will have 5 episodes. Someone who can spend a day with diarrhea and still drink fluids and go. But the moment you have multiple episodes of diarrhea, it's usually very good to go to a healthcare facility so that you can diagnose what's the cause of the diarrhea. More so at this time where we had the pandemic, because most of these bacterial causes of diarrhea, like cholera, are spread rapidly. It only needs one individual to spread to a large population of people. Yes.
And you've talked about the issue of what causes it, of course, the risk factors and all that. Let's talk about prevention. If I am to somehow try to prevent myself from contracting any condition that would end up in diarrhea, then what am I supposed to do?
Cleanliness is key. For diarrheal diseases, cleanliness is key. Wash your hands. Wash the vegetables that you're going to eat raw. Cook food adequately. That's what we usually advise people. And I believe that's what you've been taught from the sciences of our days. Keep clean. Wash your hands well when you're visiting the toilet, when you're out of the toilet, before you take your meals. Wash your fruits and vegetables cleanly. Let your food cook well. And that's basically, that's usually most of the time, that's the best preventive method of preventing diarrheal disease. You'll notice that during the COVID-19 pandemic, when we introduced hand washing and wearing masks, most of these common communicable diseases, actually the levels went down. So things like flu went down. Things like diarrheal diseases really went down. Why? People began a habit of using sanitizers, washing their hands well, washing their food well. The level of cleanliness went up. So these diseases, diarrheal diseases, actually went down. So this is actually something that works. And we can even see from the public that this is something that actually works. Most people stopped going to unhygienic places to take meals. We were doing 10 meters, a meter apart. So close contact was also reduced, because these diseases are, apart from being orophycal transmission, meaning transmitted by the mouth, close contact with such individuals also can easily transmit these diseases. So we actually saw a large decrease when we increased our sanitation levels. Yeah.
Okay, thank you so much for that. And of course, the last question for this, because I think it's just cleanliness, guys. Just need to be clean. Are there any long-term effects of diarrhea?
Yes. The reason why diarrhea becomes an emergency is when you're diarrheaing and you're losing fluids and electrolytes, the major organs are being affected, most of the kidneys. Now, acute kidney injury basically means how can I put it? When you develop kidney failure, that takes a shorter time to develop. It's an acute process. So that kind of kidney failure now when you come to hospital, can result in a doctor actually using dialysis to actually resolve these conditions. Because when you have acute kidney injury, you're not filtering your blood well. So basically, you're not even making urine sometimes. So we need to do dialysis. Now, this also has its own complications for an individual, infectious complications for the tubing, though we maintain cleanliness when you're putting those dialysis catheters. Can develop acute kidney injury that can progress to chronic kidney disease that will require long-term dialysis for this individual. So you end up having a patient that didn't require dialysis before, got diarrheal disease, developed acute kidney injury that progressed to chronic kidney disease, and now has resolved to the point that they require dialysis to actually manage them for a lifelong. So there are complications of diarrhea. But the good news is when you sort it out early, you prevent these complications. So the reason why this is an emergency is because we don't want to get to the point whereby you have organ damage or organ failure as a result of dehydration. Yes.
Okay. Biggest mistake people make when dealing with diarrhea?
Not necessarily misdiagnosis, but more or less self-treatment with antibiotics. We've misused antibiotics to the point that if someone has diarrhea, they rush to the chemist, nataka flagyl. That's the commonest antibiotic that they use, nataka flagyl. As I said earlier, most of diarrhea is self-limiting, meaning it will resolve on its own. You just need rehydration. So when you do have 1 or 2 episodes of diarrhea and it resolves, you actually don't need antibiotics. That means it was a self-limiting causing any diarrheal disease. You have multiple episodes of diarrhea. Instead of going to the chemist to take an antibiotic, because sometimes you might be taking an antibiotic that actually might not even work for the diarrheal infection that you actually have. The best point is to go to a healthcare facility, get tested. Most of them is just a stool test and a blood test. Just get tested. Let's find out why you're having this diarrhea and let's treat it appropriately. Now, misuse of antibiotics can lead to antibiotic resistance, which is something that we really struggle with as healthcare workers, because when you misuse these antibiotics, you take antibiotics for the wrong use, or you take antibiotics that you don't actually need, you can easily create resistant bugs. A good example is, you remember the super gonorrhea cases in Nairobi that happened because of misuse of azithromycin? That's the case that you're talking about. So diarrheal diseases, most of them are self-limiting. If it becomes to the point that it's making you very sick, get to a hospital instead of self-medication. Yes. If you really need to do self-medication at home, fluids. Drink lots of water. Drink lots of water. Drink lots of water. If you drink lots of water, then rush to a healthcare facility. Yeah.
Okay. That is Dr. Nathaniel Mwadime from Tophill Hospital. We are tackling common abdominal conditions. Of course, we started with diarrhea. I prefer using that word. You know why? Anyway, ladies and gentlemen, moving on forward, we will talk about acute appendicitis. Mm-hmm. And of course, I think I'm getting the pronunciation for that because I've been a victim before. Let's talk, first of all, before we even go into the details of what it is. Why all that pain?
The abdominal organs have an enteral nervous system. The connectivity is very much a lot in the abdomen. So this kind of pain becomes mostly diffuse before it becomes concentrated. So that's why the pain is so severe. Most abdominal conditions, just like fractures, do have very severe pain. And it's, how can I put it? Is it a good thing? Yes, because it raises an alarm very fast for you. If these conditions didn't come with pain, you will have ignored them. So pain is actually the main indicator that drives people to hospital. The reason why most people come to hospital is because they are feeling pain somewhere in their body. So it's a very good alarm for you as a person that nikubaya twende OC. That's it. So follow for the pain, but that is a good indicator that you should actually come to hospital.
So then what is appendicitis?
So appendicitis is basically inflammation of an organ in your abdomen called the appendix. So what happens? It's a very small organ in your body, barely has any functions, but we classify them as the vestigial organs, so that barely having any function. But now when it gets inflamed, be it most of the time due to an infectious process, when it gets inflamed, grows bigger, it gives you that kind of pain. Now the reason why it's an emergency, acute appendicitis, is because of the risk of rupture of that organ. Now when that organ ruptures, the contents within the appendix, the infectious process that was occurring within the appendix spreads to other regions of the abdomen. Now that is usually very hard to deal with. The treatment process takes longer. The complications are more for such individuals, and that is why it becomes a key emergency. Yeah.
Is age a factor when you talk about appendicitis?
Yeah, it do happens with age. You'll rarely see this in children under the age of 5 years. Mostly see it in teenagers and young adults having appendicitis. You rarely see it in older individuals, probably above the age of 60, above the age of 55 and above, rarely having an inflamed appendix. Yes, there's an age distribution for this condition.
And is there any known reason why maybe it could be affecting those particular ages?
I will clearly not say why they're affecting most of those individuals, probably because of the rate of activity that they do, how active they have become during the kind of foods and testing that they're actually having, but mostly being seen to be distributed within these age groups.
Any preventive measures is there anything I can do to just avoid having I'm a twende kwa treatment to direct?
Not much. Sometimes because of how acute it occurs, not much. If it's an appendicitis probably due to trauma, the best way is to avoid the trauma causes, maybe a stabbing wound onto your abdomen that goes towards the region of the appendix, or things like poor feeding habits, high cholesterol diet, and things. And you should stop looking at your friend next to you.
I'm not looking at him.
high cholesterol diet and such kinds of foods can actually predispose you to a higher risk of getting things like appendicitis. But reducing such poor eating lifestyle habits can go a long way in actually reducing the risks of having the disease.
Of course, anytime we talk about conditions here, we talk about eating habits. And so it's become a topic of discussion in the studio. That's why anytime it's mentioned, you realize people looking at each other, those in the cameras trying to look down. Anyway, actually, let's move forward and talk about the treatment for acute appendicitis. How is the treatment like? And now that you've said it's an emergency, how should we actually handle it as we head towards hospital?
So, when you're having, typically the symptoms of acute appendicitis is right abdominal pains on the lower side of your abdomen, or around most of the time starts at the umbilical area, the navel area, starts around that region, then goes towards your right hand side on the lower end of your abdomen. So and it's very acute. You have very severe pain in a short period of time. Sometimes 2 to 3 days. Now, when this sometimes it can be accompanied by diarrhea, sometimes you can have vomiting, you can have fevers in your body, lack of appetite, but that kind of pain is usually very significant in its point. So when you're having such kind of pain, the best thing you should do is actually present to a healthcare facility. There are quite a number of organs there on the right lower end. Also for women also will have the fallopian and the ovaries around that region at the same place. So when you're presenting with this kind of acute pain, the best scenario for you is to go to a healthcare facility. Do not assume it. It's usually very bad pain. I do not believe most people can assume that kind of pain. As you have said, sharing from your own experience, you cannot actually assume that kind of pain. So if you're having that kind of severe pain and you present to a healthcare facility, by testing it, there's a scoring system that we use. By testing it, depending on how severe it is, the management can be medical and surgical. Now, surgical management is mostly used for acute appendicitis because of the risk of rupture of the organ. Now, when it ruptures, the complications are even more. So when you have acute appendicitis with a higher risk of rupture, surgical approach is usually the best for this kind of condition. Yes.
Okay, let's talk about the recovery period, especially in situations where we've gone for surgical interventions. How is the recovery for acute appendicitis of course, give us the experience in terms of how you would categorize the surgery. Is it major or is it just like a minor thing? How do you?
Major and minor surgery quite subjective in its own sense. How can I put it? Yes, you will go to the hospital. You'll be taken to theater. Utalazwa, as people say, you'll be put under anesthesia control. The surgery will be done. The time frame of the surgery, probably within an hour, the surgeon is done. So it can be classified as a major surgery because of the fact that you're taking into theater and put under general anesthesia. The recovery period after the surgery is usually very fast. The good news is probably within 24 to 48 hours, you'll be out of hospital. The main purpose for that usually is how we control the pain and the introduction of food. Now, depending on did it rupture or not. With acute non-ruptured appendicitis, meaning it was an inflamed appendix but had not ruptured yet, meaning there's no cross-contamination with the other parts of the abdomen, the recovery period is usually very fast. The moment you remove the inflamed appendix, the pain drastically reduces. When the pain drastically reduces and you've started to feed early enough, you can be out of hospital within 24 to 48 hours. Well, now it's ruptured appendix. Now, because of the complications, the infection that has spread to other parts of the abdomen, you have to stay in hospital longer. You're put on intravenous antibiotics. We monitor how we introduce food to you. We monitor the after effects of the complications. So the recovery period at that point is actually longer. So that's why we do advise people that you should go to hospital as early as possible. The moment you notice this kind of pain, and usually sometimes it's very classical, started at the umbilicus, went to the right side of your abdomen, and it's severe pain. It's usually very severe pain. So when it happens like that, rush to a healthcare facility. Early diagnosis and early intervention is usually key for this condition. Yes.
Okay. This is a question so many people used to ask me. Do you feel any difference in terms of after its removal and all that, now that you've said that it's an organ that may not necessarily be having any particular functions in the body? Mm-hmm. I can answer that, but then I would want you to answer it.
The response will be biased. Mine has never been removed. So probably the patient who experiences it will say, I feel lighter, but no, not really. Because of its non-functionality in the body as of now, because of its non-functionality, when you remove an acute appendix that is not ruptured without complications, you go back to work easily. You'll feel pain because you opened up your abdomen, but that pain will continue reducing to the point that you go back to whatever you're doing. If you're a sportsman, you can go back to sports. Yes.
Okay. Thank you so much for that. Of course, not so many questions about these particular conditions. We're just trying to kind of create the awareness for it, and it is important that when you have that pain, then you visit the hospital, as Dr. Mwadime has said. If you're tuned in, if you just joined us, we are talking about common abdominal conditions. We've talked about diarrhea. We just tackle appendicitis. And if you have any questions to shoot to Daktari, please don't hesitate, because we'll just keep moving. I think we still have like 3 conditions to talk about. So we're now headed to intestinal obstruction. Hope I'm also saying that right. Daktari, what is intestinal obstruction?
So just as the term says, this is obstruction in the flow of contents in your intestines, both the large and the small intestines in your body. If you can remember from your science in primary school, the intestines are divided into the small intestines and the large intestines just by the appearance of the organ itself. The large intestine is large, the small intestine is small. So obstruction in the flow of food, of contents, be it food, be it gas within the intestine. When you have obstruction of that flow, that's basically called intestinal obstruction. Yes.
Okay, and what causes an intestinal obstruction?
So you can have mechanical causes, probably post-surgical causes. You had a surgery, an abdominal surgery earlier before. Then you have something called adhesions, basically just fibrous tissue that when it was healing, caused a band around your intestines and stopped the flow of intestine. You can have intra-abdominal causes, compacted stool that is not actually moving. You have bacterial infections that can actually lead to normal peristalsis not occurring in your intestine. Peristalsis just means the flow, the way the intestine reacts to help with the flow of contents along it. You can have, for children, mostly probably children under the age of 3 or 5 years of age, worm infestation, things like roundworms that can actually obstruct the intestine and stop the flow of food. So there are very many causes of intestinal obstruction. Yeah.
Okay, and let's talk about the issue of diagnosis. Of course, for all these conditions, I know I must come to the hospital for me to be diagnosed. But then, what are some of these things that I would observe and I'll be like, okay, I think there could be an obstruction within that tract?
So one of them can be not passing stool. So sometimes someone can present with severe diarrhea, and then all of a sudden you're not passing stool. Then you can have even vomiting. Whatever you're eating, you're just vomiting. Depending on the level of the obstruction, you can have vomiting. You can also have abdominal distension. Abdominal distension just means abdominal swelling. Your abdomen just grows bigger and bigger. So they have abdominal distension. So you have diarrhea or not passing stool completely. You have severe vomiting, abdominal distension, lack of appetite. Yes.
Okay. Thank you so much for that. Of course, I'll sample a few comments before we continue. There's somebody asking a very nice question here, and maybe this is the right time to read it. Somebody called Koskerap Chesir asks, what is the danger of dawa ya kienyeji ile ya kuendesha eti kuosha tumbo? Why are you laughing, Daktari? Is it something you interact with day in, day out?
It's something that you come across when patients come to you. Nasema nilikunywa ile dawa nikanifanya niendeshe completely. The thing is,
nilikuwa naosha tumbo.
Nilikuwa naosha tumbo. So the thing is, what are you trying to treat in the first place? Because there are herbs that actually will make you diarrhea to try and reduce whatever you. So what were you actually treating in the first place? And probably you were treating the wrong thing. That's now the danger of it. If you're having intestinal obstruction and you take medication to try and help to make you diarrhea, most of the time is what was the cause of this obstruction? That's the thing. If it was as a secondary to a surgery that you had a long time ago that caused adhesion, taking this kind of medication might not actually need to help because the cause is mechanical. There's actually a band that is tightening around your intestine that is preventing flow. So you taking this medication might not actually help. So the reason when you're having this kind of symptoms, you should be coming to a healthcare facility is because it is easier to find out the cause of this obstruction that you're actually having. So I will not advocate for
your dawa ya kuosha tumbo.
I will not advocate for it. And also the complications that come with this taking traditional herbs and medications. Most of them, either the medications are not filtered enough. So yes, there is the ingredient that you actually need, that is a laxative that will help you with the diarrhea. But now the other toxins that are also found within the same can lead to other complications. Things like if you give such kind of diarrheas, also to children under the age of 5, can lead to acute liver or acute kidney infection injuries. So you can have liver failure, you can have kidney injury because of taking the kienyeji, because of the unfiltered contents. Yes, there is the organic bit that you actually need, but now the unfiltered contents within that's why I will not advocate for kienyeji.
And of course, when you talk about that and when you talk about science, then it brings us to the topic that we discussed before we went on air. Actually, the name Mwadime could suggest that you come near from around Kilifi. And most probably you know Shahaola. Anyway, let's move on.
That was putting me on the spotlight.
Do you have anything to say for yourself?
I will choose not to comment on it.
Could you talk about dry fasting for a minute?
I will choose not to comment on it, just to condemn it. It's very sad. It's a very sad thing that you are going through. Many lives have been lost. So my comment is, it's a very sad thing. I will strongly condemn such a thing. Yes.
Okay, maybe we'll get some time at some point to also talk about fasting and how much you should do it and how much you should not do it and how scientific that is. Anyway, let's move forward to now treatment of intestinal obstruction. How is treatment like?
So depending on the obstruction, sometimes you have partial obstruction. Partial obstruction means it's not complete obstruction. There's still flow of contents, be it gas. So when you have partial obstruction, the first course of treatment might be conservative management. One, we do something called decompression. So you'll find out that when you go to a hospital facility, the doctor will introduce a nasogastric tube to try and decompress the contents of the gastric contents, and also give you something called an enema to try and help you pass stool for partial obstruction. For complete obstruction that contents are not flowing, the treatment for it is surgical intervention. So the surgeon will have to go in and do something called a laparotomy, go in, find out where the obstruction is, and actually correct, so that food content can actually start flowing again. Yes.
Okay, and how is recovery like?
Now, depending on with this, you'll notice that with these abdominal conditions, the recovery rate usually is dependent on the severity of the condition and the promptness. Okay, this is the point. If you're hearing me, the promptness of care. The promptness of care. So for things like intestinal obstruction, if it was a partial obstruction, you've done conservative management, you've been able to pass stool well. Usually the recovery of care is usually very, very fast. You come to hospital, we diagnose you with partial obstruction. We give you a bowel rest. So basically we decompress the abdomen via enema, NGT tube. We give you fluids, because most of the people that have intestinal obstruction also have dehydration issues. You're losing important electrolytes. So we rehydrate you with fluids. In case you need antibiotics and you have signs of infection, we give you antibiotics. When you do this, probably within a short period of time, you go back home. Same to complete intestinal obstruction. If it's diagnosed early, before the complications get too severe, surgery is done, the recovery period is shorter. But as you introduce food slowly, you go back to it. Now, when the complications set in, you've had bowel obstruction for a long time, the bowel becomes gangrenous. Or in simpler terms, it starts dying off, pole. So when that happens, you have other issues that probably I'll talk about later in the next topic, things like peritonitis, that will require both surgical intervention and a long hospital stay for medical intervention. Yes.
And are there cases where abdominal obstruction clears on its own?
Yes, sometimes it does. You can, the ones that they commonly call as constipation, sijaenda choo for like 3 or 4 days. Someone tells you, sijaenda, I've not gone to for a long call for 3 or 4 days. I took you come to hospital, you notice it's a partial obstruction. We give you a laxative, you clear the obstruction, and it goes without surgical intervention. So when it resolves on its own, it's basically meaning we introduced medical intervention. It was a conservative way of managing this condition. Yeah.
Okay, thank you so much for that. Of course, unless you have anything else to add to it, I think we've captured almost everything, including dawa ya kuosha tumbo. Anything you'd want to add on to the condition?
Yeah, because of the slow progression of intestinal obstruction, sometimes it's very hard to miss for patients out there. As you compare to the other 2 conditions that we talked about, like diarrhea that happens very fast and the condition is usually very key, or appendicitis whereby you feel very severe pain. With intestinal obstruction, that the development is insidious or slowly. It develops slowly. Sometimes patients will come to hospital when the boat has sailed too far. So it's usually very key to notice that when you're not passing stool, or you had diarrhea, then all of a sudden you're not passing stool, you're having very severe vomiting, the appetite is very low. It's usually very key to rush to hospital, so that you can find out, do you actually have an intestinal obstruction that might be causing this. Sometimes it can happen because of a twist in your abdomen, something called a volvulus, where the abdomen just twists on itself. So when that happens, that one comes with very severe pain, and usually is a key indicator that you should be able to rush to hospital. But there are others that build up slowly by slowly. So it's very key to notice one of these symptoms that are merely non-specific. You're having diarrhea, all of a sudden you're having constipation, you cannot be able to pass stool, you're having very severe vomiting, or your appetite is just very low, you're feeling so weak, you feel like your abdomen is distended. It's usually very good to rush to hospital. Yeah.
And of course, when you talk about these abdominal conditions, those of us who grew up where we used to have animals, that is ng'ombe na mbuzi. There was a time you would see our parents wanashika miguu ya nyuma
miguu ya mnyama.
Yeah, ya mnyama. And then like there's something in the stomach. We've seen things. Anyway, let's move on to the next topic. We've seen things, daktari.
Yes.
Anyway, peritonitis. What is peritonitis, and how do you even diagnose it?
So peritonitis basically means just inflammation or infection of the peritoneal cavity, the peritoneum itself. So the peritoneum is in layman's time, it's the covering of the abdominal organs. The abdominal organs have a sheet-like covering that covers them. Just like the lungs have a pleural cavity, a pleura that actually covers the lungs to protect it, the peritoneum also has that. The abdomen also has that. It's called a peritoneum. So it's usually a sterile environment. But what happens is when you introduce infection to it, be it via trauma, you have a stabbed wound, you got into an accident, you ended up having a rupture of your internal organs. When you introduce infection to it, or you have spontaneous infection, probably because someone is immunocompromised, if you introduce infection to it, that's when the time it becomes peritonitis. Yes.
Okay. And of course, that means then that the causative agents depends on the kind of infection that went there.
Yes.
But then what are some of these common causes, rather common symptoms that somebody who has the condition would have?
So peritonitis in itself, most of the time, is caused by infections within the abdominal organs, or the organs that are adjacent to the abdomen. Like for ladies, probably the ovary, the pelvic organs, the ovary and the fallopian tubes. If they get any kind of infection, that can spread to the peritoneum. So most of the time, it's caused by organs within the abdomen itself. So, for example, if you have a ruptured appendix, intestinal obstruction that caused gangrene in your intestines, and this infection spreads to the peritoneum, you get peritonitis. Now, the most common symptoms that someone will present is fever, very high fevers. When you come to hospital, you have fevers of above 38 degrees Celsius. So you have very high fevers, you have general body weakness, you have abdominal pains. This one also has abdominal pains almost to the point of the pain you feel with appendicitis. Yes, you have very severe abdominal pains. You can also have vomiting and diarrhea because of the proximity it has to the abdominal organs. Yes. And
always, of course, before you got the treatment, the science, primary science format, prevention. Is there any way we can prevent
peritonitis?
Yeah, peritonitis.
Usually is to prevent the cause of it. If it is trauma, stab wounds and things like that. If it's intra-abdominal disease or infections, if you have something like an acute appendicitis that has not been treated early, leads to rupture. You have something like a peptic ulcer that actually leads to perforation, and the contents go into the peritoneum. If you have something like intestinal obstruction that actually leads to gangrene, that can lead to infection of the peritoneum when the contents of the intestine leak into the peritoneum. If you have a pelvic infection, that actually can transmit it to the peritoneum. So most of the time, the prevention of peritonitis is usually by dealing with the intra-abdominal conditions earlier enough. Yes.
Okay, and let's now talk about treatment. And of course, when we talk about treatment, then I want to assume this is a membrane. I don't know if it is.
Yes.
If that is, that would be a right picture of it. So how easy is it to heal?
Treatment depending on the severity of the peritonitis. If someone comes to hospital and they're having very severe abdominal pains, their abdomen is quite rigid, you can't even try to what we call palpate it. Jaribu vile daktari anakuja kwa hospitali anaona anafinya tumbo yako. So you have generalized abdominal pains. It's all over your abdomen. It's very severe pain. Your abdomen is very rigid. Most of the time, the peritoneum is infected, and probably if you have had no background history of trauma before, just happen on its own, or most of the time it can be because of a perforation within your gastric, your abdominal organs. Surgical intervention is key. So for peritonitis, it's a two-pronged approach because of the severity of the condition. So someone comes with very high fevers, diarrhea and vomiting, meaning the infection is already set in. You will need intravenous medications, antibiotics. And at the same time, it will also require surgical intervention because we need to arrest the cause of the infection. If it's a ruptured appendix, we need to correct the appendix because the infection has already been introduced into the peritoneal membrane. So if you have a ruptured appendix, we need to sort out that appendix. If you're having intestinal obstruction that actually leads to peritonitis, we have to sort out the intestinal obstruction. And as we continue sorting out the peritonitis. So antibiotics are key, and also surgical intervention is needed for the cause. If it's for a lady and you have an ectopic pregnancy that has actually ruptured your fallopian tubes leading to infection into the abdomen, you need to sort out the ectopic pregnancy that has actually ruptured as we deal with the peritonitis. Yes.
And when you talk about the severity, of course, in terms of what are the dangers now that are involved with this particular kind of infection to the person, especially in terms of stages, or if at some point it can be even a cause of death or something like that?
Usually, most of the times with these abdominal conditions, the severity is usually in tandem with the kind of symptoms that the person will present with. You have very high fevers. With peritonitis in itself, it's usually more serious than these other conditions I've just talked about, like acute appendicitis, because the moment you have peritonitis, that means there's a perforation somewhere. If it's not caused by trauma, that means there's a perforation inside the abdominal organs, the intestines, or probably the pelvic organs that have caused lead to peritonitis. So by the time you're getting to peritonitis, sometimes it is a complication of these other conditions. Now, when it becomes a complication of these other conditions, recovery is longer. And with the abdominal conditions, dehydration is usually a very big issue. Why? Because you're not taking fluids orally. So you're not getting enough. At the same time, you have diarrhea. You're losing too much fluids. At the same time, your intestines, the work of absorption is not occurring so well. So all this is causing you to have very severe dehydration. This kind of dehydration can lead to kidney injury. Usually the kidney is one of the organs we really need to take care of, can lead to kidney injury. Now this kind of kidney injury, as I said earlier, can progress to chronic kidney disease. If you have severe sepsis or severe infection, can also give you shock that can lead to kidney injury and other multi-organ failure. So that's why the treatment of this is very key. Most of the times peritonitis will develop because of intra-abdominal conditions. So it becomes a complication of other conditions. That's why we need timely intervention is key. Yes.
Okay. So anytime somebody has something, pain at the abdomen, it is important that they report to a hospital.
Yeah, because ignoring it is usually very, the consequences can be dire. Because most people will not come to you with peritonitis. By the time it gets to that point, it's usually probably a complication of something else. So usually when you're having very severe abdominal pains, my point is do not ignore. The same way we do not ignore very severe chest pains. Same with abdominal pains. If you have very severe abdominal pains that the onset is very acute, within 1 day, 24 hours, 48 hours, you have very severe pain in any part of your abdomen, rush to hospital. Because now if you get a rupture, the complications are usually very dire. Yes.
Okay, thank you so much for that. That is Dr. Nathaniel Mwadime from Tophill Hospital. He's here today to teach us about common abdominal conditions. Of course, we are coming to the tail part of the interview. If there's a bit you've missed, because I've seen people come in after when we already moved into the interview, of course, you can still review later. Help me spread the word. Let's share this with our relatives, because the purpose of actually doing this is to edify the community, to edify you and me, to make sure that we live in a safer environment, and also we live in a more knowledgeable environment. Of course, let me just sample some of the good mornings that we've received here and the questions. Fanuel George says, good morning, say hi to Dr. Mwadime. Thank you so much. Queen Shi, thank you so much for following. I can see Kelly Sergeant says, good morning. Kimuge Portrait says, very insightful. Thank you so much for those particular questions. Mr. TCMC says, morning, tuned in. Nowadays, we prescribe our own medication, which is very wrong. Yeah, as Dr. said, anytime you feel sick, it would be wise for you to actually rush into the hospital. And just the same way you wouldn't assume chest pains, then don't assume abdominal pains. The last condition for this particular day, I don't know if Dr. will say last but not least, is cholecystitis. Okay, now with the medical terms, guys, I'm doing bad, but slowly I'm improving. So, Dr. what is cholecystitis?
That was actually at first that was actually a good attempt. Cholecystitis basically means inflammation of the gallbladder. The gallbladder is an organ that stores bile in you, that is just adjacent to your liver, that stores bile. So when you have cholecystitis, it basically means inflammation of this gallbladder. Most of the time, it is caused by gallbladder stones, either on the gallbladder itself or on the tract that leads the flow of bile to the intestines. So if you have an obstruction on the tract, you have accumulation of bile and the contents of the bladder, then it inflames, basically just swells, and the lining becomes thicker. Then it gives you very severe pain. So cholecystitis just means inflammation of the gallbladder. Mm-hmm.
Of course, I will still go back to primary science. Unakumbuka kitabu ama wewe ukutana labda tunaongelea vitu je mimi na Kim, my producer only know. What was the function of gallbladder in the human body before we
It's a majorly a storage organ. When bile is produced by the liver, it stores in the gallbladder, flows towards the intestines to help with digestion of things like fat. So it's majorly a storage organ of bile. Yeah.
And you've talked about how the acute cholecystitis occurs. Of course, Kim is laughing at me. You've talked about how the condition develops.
Yeah.
But then now let's come to the symptoms of this disease. How would I know that maybe there's something now happening at somewhere in my gallbladder?
Pain is usually the key thing here. Location of the pain, it's mostly on the upper part of your abdomen. So it can be in the epigastric region, the region just below your sternum, where the stomach is actually located, going towards the right side, but now on the upper side. It's called the right upper quadrant, where the liver is also located. So you have very severe pain at that point, to the point that if you try pressing on that side of the abdomen, the patient is in writhing pain. Yes. So pain is usually the main symptom that people will present with. Some other symptoms can be nausea, vomiting, severe vomiting. You can have diarrhea. You can have jaundice, depending on how severe the disease is. Jaundice basically means yellowness of your eyes. You can have things like jaundice. You have pale urine. You have yellow urine. You have pale stools, depending on the cause of the cholecystitis. But pain is usually the key thing. Yeah.
Let's talk about age. Let's talk about food. Is there any relationship or any other risk factors that could predispose a patient to this particular condition?
We usually see it mostly, it's more common in the female gender as compared to the male gender. And most of the times it's because, and also foods like fatty foods, high cholesterol and foods that contain high lipids and high cholesterol in your food content can also predispose you to get acute cholecystitis. Yes.
And now let's talk about, of course, the treatment options for it. How is it treated? How is it managed at hospital level?
Now, depending on the cause, as I said, almost 90% of it is because of gallbladder stones. So the treatment of acute cholecystitis most of the time might be conservative treatment, meaning we might not need to go in and operate on you. So most of the time it might be conservative treatment. We give you medications with antibiotics. We also give you fluids for rehydration because, as I told you, someone may present with severe vomiting and severe diarrhea. We give you pain management as we monitor you in hospital. Most of the time it can resolve within 2 to 3 days. Someone goes to hospital within a week. Someone goes home because of the resolution of the symptoms. Now, when the condition becomes too severe, you're having things like very severe jaundice, your liver function is getting deranged, you're having very severe pain, and when we investigate you by an ultrasound or a CT scan and we find out that you have a very thick gallbladder and it's causing obstruction, now surgical intervention can come in. Yes.
Okay. And when we talk about, of course, we'll still talk about severity and how much it risks someone's life and all that, and also about the pain. And how is it something that happens gradually, or it's something that just hits once?
With acute cholecystitis, it is something that happens very fast. You've had stones before, but now you get a gallbladder stone that is thick enough to block the flow of bile. Now that kind of pain builds up very fast. So you have very severe pain. So the severity of this usually is on the pain scale. How much pain are you feeling? And the conditions, at the state at which you present to hospital. Someone might come in very sick, very dehydrated, a lot of vomiting, very severe epigastric pain. You do investigations to find that it's a gallbladder, a cholecystitis secondary to gallbladder stones that are causing obstruction on this organ that might require immediate surgical intervention to either drain the bile or remove the gallbladder itself. Yes.
Okay, so the gallbladder can actually be removed.
Yes, it can be removed.
So where will the storage happen?
There will be just flow of bile. We just make sure that the flow of bile is, because bile is important in digestion of things like fat. So we just need the bile to flow. So when you have inflamed gallbladder, and it's very thick, you don't want it to rupture, because now, as I told you earlier, like when appendix rupture, it can give you peritonitis. But a gallbladder rupture can also give you peritonitis. So the complications of the rupture are usually very dire. So you can remove the gallbladder and you still survive. Yeah.
Okay, and of course there's somebody called Nathaniel Mwadime, just like you, watching from Kilifi, and that's why I was hinting to you that actually you could actually be knowing. Anyway, moving on, Daktari, of course, when you talk about the gallbladder, of course, also huko kwa street mtu akiangana hasira unasikia watu akimwambia punguza bile wewe. I think this is a nice opportunity to ask you more about the bile.
I sincerely don't know where that term came from. I don't know whoever coined that term. I don't know what he was really thinking about. Probably alijipata amekula ile ya kuku, then ikawa inamchoma mbaya sana. So
anajua Kilifi bado Kiswahili hakikuwa kimeharibika sana. So unajua katika lugha ya Kiswahili kuna ile kusema nyongo, kuna mtu I think that's where they borrowed it and brought it to English until ikafika bile.
I think he was relating to the sour bit and the sour taste that you actually have ukikula kwa ya mnyama kama wa kuku. Yeah.
Okay, thank you so much for that, Daktari. And of course, I'll come back to you so that you give us your general now advice about these abdominal conditions. But then before we come there, ladies and gentlemen, we are coming live from Dawi Afrique Photography. If you need a family friendly space to take photos with your family, walk into Zion Mall and ask to be directed to Dawi Afrique Photography. We are situated at the basement of the Zion Mall building. Walk into this particular space and make sure that when you come with your family, because there is enough space for you. There is a nice experience in front of the camera and very dedicated staff to make sure that you get the best memories, not just for you, but also for you and your family. If you need to dress before coming to the studio, you need to dress to be addressed, then you walk into D-Square Fashion House. If you need to learn to dress people, you want to do fashion related courses, including very short courses like just hand stitching, then consider walking into D-Square School of Fashion Design and Tailoring. Apart from having very pocket friendly tuition fees, the other factor is that you are able to access a fashion house and get to learn from a practical work environment. All I can assure you is that once you walk into D-Square and come out as a graduate, you are able to open your own business and start. You can even open a fashion house and still run it very comfortably. So D-Square School of Fashion Design is a place to go. Now, Daktari, as we wrap up this particular show, give us a general advice about all the conditions we've talked about. Of course, in my script, I may have missed one or two things that maybe you feel it is important that our viewers today get to know.
So I think the take-home message will be, depending on the condition that we talked about today. One, do not ignore abdominal pain. If you're feeling pain anywhere within your abdomen, do not ignore it. It's good to go to a healthcare facility. Let us make the diagnosis, because as I said earlier, early prompt care will reduce the hospital stay, will reduce the complication. Secondly, for diarrheal diseases, self-medication. I really do discourage self-medication. As I said earlier, most of them are self-limiting. You just need to drink lots of fluids and you're good to go. So self-medication is really leading to creation of resistant strains. And it's become very hard to actually deal with other conditions, because if you start having very many resistant strains in the system, some of these antibiotics will be rendered useless, and we are not producing more cadres of antibiotics again as fast as we used to. So it's going to be very hard to actually tackle these conditions. So self-medication, more so for diarrheal diseases. I really do encourage our viewers that please, we should refrain from self-medication. If you're having diarrhea, oral rehydration. If it is persistent, get to a healthcare facility. If your child is under 5 years of age and they're having diarrhea, as early as possible, go to a healthcare facility, because of the risk of death in children under the age of 5 with diarrheal diseases. Yes.
Okay. Thank you so much for that. Of course, immediately I'll still come back to your now parting shot. Your parting shot.
Okay. Wow.
Najua zimefuatana sana.
So thank you very much for this opportunity to actually be able to talk about some of these common abdominal conditions. My message out there will be, it's early prompt, early diagnosis, early care for best outcomes for these individuals. And also welcome to Tophill Hospital. For any medical condition that you have, we are ready to serve you.
Okay, of course, we started with talking about Tophill Hospital, and that would be the last thing, of course, also to talk on the show. I'll be talking about, or rather, I'll be telling you that anytime now you need to visit a hospital, you need to visit a place where there is some good amount of care. The mantra for Tophill Hospital is extraordinary care, exceptional technology, extraordinary care. This is a hospital that is situated in a serene environment within the Elgon View estate of Eldoret. And I've always said that almost every way, if you're coming from Nairobi, there's a way that will lead you to hospital. If you're coming from town towards the other side, there's always that road between MTRH thereabout. And somehow you'll be able to see a sign leading you to Tophill Hospital. Coming from Kisumu, around Nairobi Road, there is a signpost there that actually directs you to Tophill Hospital. It is a level 5 hospital, and as we said, it is exceptional technology, extraordinary care. Every Wednesday, we've partnered with Tophill Hospital to make sure that we get a chance to improve your health education. So anytime you need to see a doctor, you need to see a consultant, then be sure Tophill Hospital would be the right place for you. Of course, I stopped saying walk into Tophill Hospital because I realized some people drive into hospitals. Anyway, that is on a later touch. Tomorrow will be Thursday. We'll be on the social square talking about we'll be talking about matters faith. We'll be talking about the shocks and the dramas of Shakahola. So see you tomorrow on the social square. On behalf of everyone who made effort to make sure that we have this particular broadcast, my director for the day, Kim, Fanuel, and everyone else, and also thank you for also watching this particular show. Have a beautiful day and be good. In a world where you can be anything, try to be kind.
Karibu Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through